Hello, today's lecture on Chapter 15 of your textbook is Genetic Contributions to Psychiatric and Behavioral Disorders. The primary risk factor associating with mental illness is having a close family member who is affected. Psychiatric disorders such as bipolar disorder, schizophrenia, and autism have a higher heritability than Parkinson's disease and breast cancer. Currently available psychotropic medications may be effective in only a small group of people. There are potential side effects of weight gain, tardive dyskinesia, leukopenia, metabolic syndrome, and sedation. This can lead to non-adherence of therapy. In Chapter 17, there's also a section on pharmacogenetics that will be covered later in this semester. Genetic testing for psychiatric disorders may help in accurate diagnosing by identifying the genes that link the risk to the disorders. This could also lead to new treatments and development of medications specific to patients. While we know that genes don't directly affect behaviors, we do know that genes are important in how people develop. Behavioral genetics is the study of ways in which genes influence behavior. In combination with the environment, gene variants do influence behavior. Moving into specific disorders, we'll start with the autism spectrum disorders, or ASD. With autism, there is difficulty with social interactions and language development. It is often accompanied by a narrow range of repetitive behaviors and interests. It is also known as PDD. That includes Asperger's disorder and Rett's disorder. Autism is seen as a collection of symptoms in hundreds of neurological syndromes. The phenotype varies, so prevalence is difficult to estimate. It is common in Fragile X syndrome. A specific genetic cause can be identified in only 25% of the children with autism. Where does autism come from? Tetragens, chromosome abnormalities account for about 5%. Copy number variants account for 10 to 20%. Single gene neurologic disorders account for about 5%, and several gene variants working together with the environment are also responsible in some of the cases. This chart shows genetic causes of autism spectrum disorder, or ASD. It's located in Chapter 15 of your textbook. In autism, there is variation among males and females. There is a 4-to-1 ratio for autism in males to females, and a 14-to-1 ratio male to female in Asperger's syndrome. Studies have shown in monozygotic or identical twins there is a concordance of 70 to 90%. In dizygotic twins, there is a 10% concordance. Exposure to those chemicals in utero have been identified as a cause of autism. Regressive onset autism is about 30% of the cases, and that simply means that symptoms begin between the ages of 18 and 24 months. Finding genetic associations. We know that 3-generation pedigree will help to identify patterns in a kindred. It also helps to identify addictive disorders and other social or psychiatric problems. Our next disorder is attention deficit hyperactivity disorder, or ADHD. It affects about 5% of children worldwide. It is diagnosed by a professional with experience in children with ADHD. It is also diagnosed based on observed behaviors. There are 3 subtypes: inattentive, hyperactive and impulsive, or combined. ADHD tends to run in families, but there has not been an obvious transmission pattern identified. While it is biologically plausible, more research is needed in terms of finding a genetic association with ADHD. The next disorder we're going to discuss is schizophrenia. Schizophrenia is a severe chronic psychiatric disorder with psychoses, hallucinations, and delusions. The onset is typically in adolescence or early adulthood. There is a wide variability in phenotype. It is a very complex. Epigenetic mechanisms have also been suggested as a possible component in the onset of schizophrenia. It is estimated that there is about an 80% heritability for disease development. 20% is environmental contributions, and also there are perinatal infections and advanced paternal age that have been linked to schizophrenia. Finding the genetic associations. In looking at genetic associations for schizophrenia, it may vary from person to person. The genes involved may overlap, therefore more research is needed. This chart shows us the risk of schizophrenia when a relative is affected. Looking at the relationship of the person with schizophrenia, the degree of the relationship, and the risk of developing schizophrenia. This is also in your textbook. Other factors that might be involved, but again, there is no accepted correlation that exists. Affective disorders. Affective disorders include major depression, bipolar disorder, and mood disorders. Many families report a history of both depression and bipolar disorder among their relatives. Region on chromosome 3 is associated with both of these disorders. Major depression affects 1 in 6 persons in the United States. It affects twice as many women as men. There are subtypes: major depressive disorder with psychotic features and postpartum depression. The heritability of depression, major depression, is about 50%. Bipolar disorder are episodes of mania and depression that usually follows each other in cycles. Persons with bipolar are easily distractible, agitated. They demonstrate high-risk behaviors, hypersexuality, out-of-control spending, and at times psychosis. The heritability of bipolar disorder is quite high at 60 to 85%. There is a 10-fold risk if a first-degree relative has bipolar disorder compared to the general population. There are environmental risk factors as well: cannabis and alcohol use, self-medication, and genetic influences on addictive behaviors. Some suggest that DNA methylation may play a role in developing bipolar disorder. Scientists continue looking for genetic associations in bipolar disorder, however, it's very complex and multifactorial. Now let's take a minute and look at addictive disorders. Substance abuse disorder is described as out-of-control drug use that is not consistent with adaptation and continues in spite of serious adverse consequences. A dual diagnosis is common. Nicotine addiction is 30% to 70% greater in persons with psychiatric illnesses. Alcohol dependence is a complex multifactorial problem. It is estimated at 50 to 60% heritability regardless of gender. In 41% of persons of Japanese descent, there is an ALDH2 deficiency, where alcohol consumption causes facial flushing and sometimes vomiting. This is the first genetic information related to alcohol ingestion. This graph shows alcohol metabolism. It's a two-step process that happens in the liver. The first step converts ethanol to acetaldehyde, and the second step breaks down the acetaldehyde to water and acetate. So those who efficiently break down alcohol are more likely to be alcoholics. Addictive disorders. There are genes that encode neurotransmitters in alcohol dependence. The GABA and acetylcholine, and genes of the endogenous opioid system of drug dependence, the OPRM1 codes for the opioid receptor. There's clearly a connection between some types of mental illness and addictive disorders. Experts propose a connection genetically that increase a person's susceptibility to these specific categories. Our last segment focuses on personality disorders. Personality disorders are a collection of socially distressing feelings and behaviors. They're different from what is expected in a person's culture and result in difficulty managing activities of daily living. These are lifelong patterns that may not respond well to medications and therapy. These once were considered to be entirely learned behaviors. However, now they're not clearly understood and seen more as complex and multifactorial. Personality disorders are complex and difficult to identify a clear phenotype. There is some debate on categories, and personality traits tend to be inheritable. But we know that children often share their environment with their parents, so it's really difficult to have a clear notion of how personality disorders are passed from generation to generation. Here's a chart with the different categories of personality disorders. We have cluster A, which are paranoid, schizoid, and schizotypal. We have cluster B, which are more dramatic and emotional. That includes the antisocial, the borderline, histrionic, and narcissistic. Cluster C are more anxious and fearful. Those are avoidant, dependent, and obsessive compulsive behaviors. Heritability varies with the personality disorders. Cluster A is 30% to 60% heritability. Antisocial seems to be 75% to 80% heritability, and sometimes considered a spectrum of disorders with common traits rather than just a single disorder. Antisocial is 3 more times common among men than women. Borderline personality disorder is 3 times more common among women. This concludes the lecture for Chapter 15. Please complete your assignments on Blackboard. If you have any questions, please contact your faculty. Thank you for your attention.